And now, moving forward, we invite Team ZEISS for the next live workshop by ZEISS Vision Care. Over to Team ZEISS.
I hope you can hear me again. Can you hear me? Can you hear me? Can you hear me?
Yes, we can hear you.
All right, perfect. And I also hope you see my screen.
Yes, we can see your
All
screen.
right, perfect. So welcome to my second session today. Welcome also everybody for the ZEISS Myopia Control Workshop, which will be an interaction on your clinical decisions. So what I have here prepared for you are 6 myopic children that actually need your help. So I would really love to interact together to find a way for suitable treatment for them and really see how easy myopia management could be. So Devakani, I believe if you can support me here to collect the respective responses from the audience,
Sure.
then we can go through it. So
Sure, I'll do that.
How it will work. First case, we have a patient who is a European boy of about 8 years old. He had no issues on visions, but recently some issues started, especially with distance reading. And the anamnesis showed less than 2 hours spent outdoor, myopic parents, both of them, no binocular vision disorders, anterior and posterior segment was found normal, partial squinting observed while gazing to the distance. On the right and left eye, we have pretty similar refractive error of about minus 0.75 with some small cylinder, minus 0.5 on the right, minus 0.25 on the left. The axial length ODOS is about 23 millimeters. The refractive error was not present 6 months ago on the previous examination, and the best corrected visual acuity is by 0 logarithm of minimal angular resolution. What would you recommend? Would you recommend to spend more time outdoors and prescribing ZEISS Myocare, or would you go in the direction of atropine 0.01? Nothing is needed, especially for this kid, or orthokeratology, which would be recommended from your side. Devakani, I'll be waiting now.
Yep. Okay, so we have one answer saying spend more time outdoors plus ZEISS Myocare.
That's a lovely one. First point for you. Yes, so to elaborate more in detail, the key points here from this case. So myopia in such a small age is not really considered to be standard, right? We are talking about 8-year-old kid who should be rather hyperopic than myopic, yeah? And he already showed myopia even in a lower amount, still should not be considered to be standard. On top of it, the amount of time spent outdoors was pretty much limited, and the genetical factor will, of course, support further myopization of the eye, as we have also learned of the today's talk. So the optimal solution, as shown on the previous slide, force the kid to spend more time outdoors, start with ZEISS myopia management or general myopia management spectacular lens as ZEISS Myocare, and continue with checkups. Case number 2. We have a European boy, again, about 13 years old, who comes to the clinic for a regular checkup and already wears glasses. The anamnesis here says that he spends a lot of time outdoors, actually. One parent is myopic, one parent is hyperopic. Again, no binocular vision disorders, anterior posterior segment normal. On the right eye, we have minus 0.5 with some small level of cylinder. On the left eye, we have small hyperopia of plus 0.25, again, with some small cylinder of minus 0.25. The refractive error is pretty much stable compared to the 6 months examination done previously. The axial length here is about 23.5 millimeters roughly on both eyes, and the best corrected visual acuity, minus 0.1 logarithm of minimal angular resolution. What would you do? ZEISS Myocare S, atropine over low dose, single vision like ZEISS Smart Life Young, for example, or orthokeratology? Devakani, to you.
Yeah. I'm just checking here. Okay, fine. So two answers are there. ZEISS Myocare, yes, and SV lens like ZEISS Smart Life Ink.
All right. In this case, single vision is the winner. Let's elaborate a bit more.
Okay.
So we are talking about a boy who was already 13 years. The myopia was really, really low, stable, and only on one eye. The fellow eye was actually low hyperopic. And the amount of time spent outdoors is pretty much good. So simply
Okay.
continue on such a lifestyle, wear regular glasses, and comes for regular checkups in case something should change. Also, the approach to myopia management should change as well. But for the time being, single vision is just fine.
Yes.
Case number 3, we have an Asian girl of about 12 years. She's already treated with ZEISS Myocare with a standard one for myopia management for 2 weeks. And the anamnesis says that she spends quite normal time outdoors, about 2 hours. Both parents are myopic, unfortunately. Fortunately, binocular vision disorders are not present. Anterior and posterior segments are normal. She developed quite a bit of myopia of minus 0.25 on the right eye with some small cylinder. On the left eye, minus 0.25, again with some small cylinder. The best corrected visual acuity by minus 0.1 logarithm of minimal angular resolution, and the axial length about 23.9 on both eyes. She actually complains about being dizzy and perceiving halos, and parents are hesitating whether they want to continue on myopia management or not. So what would you recommend here? ZEISS Myocare, simply force the kid to wear it, switch to Myocare S or single vision lens, repeated low-level red light therapy, or soft contact lenses, meaning the standard one.
Okay. So this looks like should be changed to ZEISS Myocare S or single vision lenses?
Very good. Yes, this is actually the target. Why are we having this?
Yeah.
And then based on the fact whether the parents want to continue or not, of course, it can be also discontinued and followed simply with single vision lenses. All right, so here are the key points. Myopia management has started and discomfort issues has shown up. Yeah, so that's why this is the switching point. Fortunately for such sort of parents, as said today already, everything is covered with the ZEISS warranty. So either the switch to the S version or to a single vision lens like ZEISS Smart Life Young or Clearview, everything is covered with the warranty. So no extra cost for the parents. Case number 4. We have a patient here who is about 10 years old. He's Asian. He uses atropine drops 0.01 for about 1 year for myopia management. The anamnesis says that he spends normal time outdoors, no parent is myopic, no binocular vision disorders, no problems on posterior and anterior eye segments. OD about 0.35 with cylinder minus 0.5. On the left eye, minus 3.5 with low cylinder of minus 0.25. The BCVA is about 0 logarithm of more, and the axial length ODOS is about 25 millimeters. The RX actually shifted here by minus 0.5 over the last 6 months, and AL increased by about 0.2 millimeters. What would you recommend? Continue on atropine, orthokeratology, single vision, or combined treatment, atropine and, for example, ZEISS Myocare?
Definitely combined treatment, atropine plus ZEISS Myocare.
And what the others said?
Once it continue on atropine,
Uh-huh.
there's another answer for D, along with
All
the
right.
existing treatment to add ZEISS Myocare lenses also.
That's a perfect one. Yes, definitely, definitely. So combined treatment is also possible. So there is no word against it. So the key points here, myopia management has already started with atropine 0.01, and parents are actually willing to continue. Efficacy of such treatment has dropped, as we can see, but this is something we can substitute or we can support with a myopia management lens. So definitely a combined treatment here, and of course a checkup after 6 months. Case number 5, we have an Emirati girl of about 11 years. She spends not so much time outdoors, about 1 hour. Both parents are myopic. Again, no binocular vision disorders. Anterior posterior segment is normal. Her myopia is quite higher, minus 3.75 with minus 0.25 on both eyes. Best corrected visual acuity, minus 0.1 logarithm of minimal angular resolution. We can see AL of about 25.6 on both eyes, and the RX got shifted but by minus 1 diopter in a year, and AL by about 0.35 millimeters. She actually refuses to wear glasses because she simply didn't like it or doesn't like it. And she develops allergy on low-dose atropine 0.01. Yeah, so there is a poor compliance. What would you recommend? Single vision lens, repeated red light, orthokeratology, soft contact lens for myopia management, or atropine?
Okay, if she has developed some allergies, probably the contact lens option, Ortho-K, soft CL for myopia management.
This is also aligned with the others?
One more answer is there, like they say, still stick on with the single vision lenses.
All right.
But most of them, option C, Ortho-K or the
Very
soft
good.
CL. Yeah.
Option C is the correct one. She's still a young girl, so definitely, and the myopia is quite higher, so single vision should not be recommended here. But especially for such cases, orthokeratology is the perfect point here. So if there are cases we simply cannot use glasses, we cannot use atropine because of whatever reasons, orthokeratology is actually the point to use. Besides that, improving of the lifestyle, she spent just 1 hour per day outdoors, so this can be also improved.
Improved,
And
yeah.
then, of course, later on, after the contact lens treatment might end, she should continue with myopia management spectacle lenses. This should be also mentioned in myopia management practice.
Exactly. Yeah.
And the case number 6, which is for us the last one. So we have here a patient who is a 3.5 years old Asian girl. So she's really, really small. One parent is myopic of her. Binocular vision disorders are not present. Again, anterior posterior segments are okay. And she already developed some sort of myopia, minus 0.25 with some small cylinder on the right and minus 1 cylinder with some small cylinder on the left. She still achieves BCVA by 0 of logmar, and the axial length ODOS about 22.4 millimeters. The parents are actually concerned about the refractive error at such a small age. What would you recommend? Single vision lens, repeated red light, ZEISS Myocare, atropine.
Okay, majority says single vision lenses.
All right, interesting. So
Maybe.
here actually number C is the correct one as well. Yeah. So even here, even for such small children, we can use myopia management lens. So
Okay.
here the key points are the really, really young age. Myopia already got present, which should definitely not be the case.
Okay.
And such finding might lead to strong and fast progression. Yeah, so here it's really crucial to have the optical treatment as fast as possible. If it still needs support, we can also go into direction of a combined treatment and emphasize the need of the regular checkups. Yeah, so this is the one key point we found, is that these sort of optical interventions like ZEISS Myocare are harmless. Yeah, so even if you theoretically prescribe it to a kid who does not need it, you will not cause any harm. Yeah, so that's why better safe than sorry, and this is why the option C was the correct one.
Okay, this one question raised. They're asking
Yes.
about the fitting on such a young child.
Yes. So fitting is definitely, and it's a really good question, and it's a concern also for more adult children. Fitting and the whole centration is really, really crucial. Yeah, so there needs
Exactly.
to
Yeah.
be an appropriate frame selected,
Yeah, and
and
compliance also, like whether she'll wear
yes,
it in the same position.
yes. So this is the let's call it not a drawback, but the
Okay.
one thing one should be really careful about is the centration
Yes.
and the alignment on the face. Yes, definitely. Should not be a problem, but the parents really need to visit the optical store and the ophthalmologist definitely more often.
Yep. True. Agree with that.
All right, so we are shortly coming to the end. It was really just a short session. So just to sum up here, steps to successful myopia management could be really summarized as early screening. And I'm definitely not the first one mentioning it here today, so I'm really happy to repeat it only. Regular follow-ups, optimally every 6 months for the axial length and spherical equivalent. Appropriate myopia management. As we have seen, in those cases, not every kid needs myopia management. However, also as said, no issues on safety has been reported. Yeah, so don't be afraid really to prescribe it, even if you hesitate, because it's better safe than sorry. Don't be afraid also about the combined treatment, and always stress out the importance of spend time outdoors. I will just once again please ask you to scan the QR for those
Okay.
who didn't make it the last time. It will lead you to our short quiz of about 10 questions. And if you answer everything correctly, you have a high chance of winning one of the exciting prizes. So you
Yeah.
can just
Let's
scan
keep
it.
it for a while. Yeah.
Yeah, definitely. Everybody got it?
Yes. Yeah.
Lovely. So I thank you very much, Devakani, for your support me here on the interaction with the audience because I couldn't see the chat from here. And I really hope you enjoyed it. And I thank you very much for your attention and collaboration. Thank you.
Sure. Thank you, Dr. Peter. That was really interesting. And we are coming to an end in Auditorium 2. Let's all move to Auditorium 1. Thank you, all speakers.